One of the ways when we look at public health that we are trying to change an issue that we've seen is we have to ask ourselves, how do we describe the problem? And then how do we measure the problem, and how do we do an intervention for the issue that we're trying to look at? And then how do we measure it? So it's got built in this sort of continuous loop of intervention. And this is sort of where we get to the point of when we look at all of these processes that we do, they're ongoing, but they're also using other parts of the healthcare system. It's not just public health acting alone. So the first thing that you need to do is we have to look at, how do we know this is a health problem? Who is impacted? Where's the distribution of the disease? So is it one area that's getting lots of sickness, the other areas aren't? That sort of helps narrow down our focus. Then we're looking at whether or not there's been a change over generations or over time. Has it gotten worse? Has it gotten better? What are the implications for that group that's associated with this health risk? Do they have less access to health outcomes that they would without this issue happening to them, or is this just sort of a life cycle issue? Then we're also looking at what you need to do to see what works to reduce that health impact on them, and then you have to see how you implement it. It's not enough to go, well, there's a problem, haha. We have to say, okay, here's the problem, here's who is affected, here's how we're going to define the problem, what kind of intervention can we do, what recommendations should we make, and then how do we get that job done? And then we sort of have to look at how do we evaluate the results. So you want to keep that ongoing process generated, and it's called evidence-based public health, the PERIE approach. And the first thing we do is we look at, when we're narrowing down the health problem, right? And that's the first thing you do, is you narrow down that health problem. You look at what is the burden of disease, and or what is the health problem that we're looking at. So if we're looking at diabetes, or if we're looking at lead poisoning in children. Two very different diseases, but two very different issues that you have to look at in public health now. We're looking at what is the course of the disease. Previously in diabetes, we looked at people who are usually over the age of 50. Now we see a new incidence. We're seeing 10 to 12-year-old children coming in, and they're testing positive for diabetes. So that's a whole new incidence. That's a whole new population, specifically in Hispanic populations. So we've narrowed down that focus of who we should look at. We're seeing something out of the ordinary. Children, we have tested for lead on infants for a very long time. If you were somewhere, for instance, in Flint, all of a sudden we saw infants having an elevated lead level. That indicates there's a problem going on. If it's only happening in that locality, then there's an issue. Now, both of these things, you might note that it's not some big public health official coming down and saying something's right or wrong. It's an individual doctor or hospital that is identifying a problem. And this is sort of how the medicine part, where it looks at individuals, they report what they see. If it's an outlying incident, or if they're starting to see new cases of something, they report that to the Center for Disease Control. So, for instance, the woman in Flint reported it to the public health department, and they supposedly reported it to the Center for Disease Control. So you've got this sort of chain of command, but you've also got each body knowing what's happening. Now, you've noticed these are two different political institutions, two different departments of health, public health, that are also funded through two different entities. And in the Flint case, that causes a huge problem. We're also going to look at what kind of interventions could we do. What's the course of the disease? Well, if someone gets diabetes when they're very young, then their ability to provide for themselves and be an active participant in their life is going to go down. If someone gets it when they're 60, 65, they're already retired, so they're probably not going to work, so we're not going to see a reduction in taxes. So we're sort of looking at what's the life cycle of the person when they get it, what losses, gains might they have. If an infant gets lead poisoning, we do know that there's no acceptable amount of lead, so we know that they're probably going to have mental and physical capacities that are going to be diminished. We also know that it's very hard to undo that on a human brain. So we have two things that we know are going to go badly, two ways we know the disease is going to hurt these individuals. Then we want to look at what is the distribution. So we looked at specifically Hispanic young children under the age of 12. We've looked at infants with high lead levels in Flint, Michigan. Okay, so we've narrowed it down. We've determined what's the implication for what we've seen. And then the next thing we want to do is look at what implications does that have for what we do next. How do we then take that? We've defined the problem, we've defined the population. What do we do next?